name is Judith Mickle-John. Our team conducted a study in a regional community in Queensland, and the project was titled "We Just Don't Talk About It: Indigenous People's Perceptions of Cancer in Regional Queensland." We'd like to talk you through this project today. So Christina Bernardes will talk through the background of our study. I'll be describing the methods that we undertook in doing the project. Greg Pratt will review the findings and the results from our project, and Brian Ali would be reviewing the conclusions of the project. I'd like to take this opportunity to thank QIMR Berghofer for funding this project, as well as the community who worked alongside us in doing this project.
Hi, I'm Christina Bernardes, and I'm going to give you some background and the aims of our study. So we know that the incidence of cancer for Indigenous and non-Indigenous are similar, but mortality is still much higher. Indigenous people with cancer have poorer outcomes due to lower screening rates, health system barriers such as lack of culturally appropriate services and discrimination, delay in diagnosis, less optimal treatment, and strong beliefs about the causes and treatment of cancer. This project was requested by the community and had two aims: explore and make visible the perceptions of cancer in the community, and to develop a resource to inform community perceptions of cancer and its treatment.
So now to describe the methods that we undertook for this project. So the team used qualitative participatory methods. This means that the project was defined and driven by community. We identified and engaged community champions for the project. Community consensus was the main decision-making approach used, and qualitative data was collected through community forums and yarning circles.
Hi, my name's Greg, and I'm just going to quickly step us through the results, key learnings, and community perceptions identified through the project. So a number of themes were identified through thematic analysis, namely that stigma, fear, and death are major influences to creating an environment of silence in a community. Secondly, that support is important to survivorship. And finally, that an awareness of cancer serves to promote an environment for people to share their stories with their family and their friends. In identifying these themes, the community chose two strategies to make visible these perceptions. Firstly, creating a quilt, with each quilt square representing perceptions of cancer, and secondly, producing a calendar with messages promoting healthy behaviours and cancer screening. A group of women met regularly over the duration of the project to yarn about cancer and to create the quilt, which was unveiled at a community event later that year. The overall project was viewed as invaluable to promoting conversation about cancer with family, friends, and the community at large, as well as with health professionals. Quilt was displayed at the primary health clinic and continues to serve to raise awareness about cancer in the community.
My name is Brian Ali. I'll talk about the conclusions to this project. In this study, community voice was a powerful tool. Engaging community champions is critical for project success and sustainability. Conversations held at a community level about cancer can reduce stigma and improve cancer awareness and participation in screening and help-seeking behaviour. And primary healthcare professionals reported that the project raised cancer awareness in the community. We'd like to thank the community for their participation and kind support throughout this project.